Hello and welcome to my YouTube channel. Today in this video we're gonna see 20 multiple choice questions on placenta previa with their answer and some brief explanations. So at the end, tell me how many questions you answered correctly in the comments section down below. So let's get started. The first question: which of the following is the correct definition of placenta previa? A. Separation of normally attached placenta from the uterine wall. B. Implantation of fertilized ovum outside the uterine cavity. C. Implantation of placenta in the lower segment of the uterus. D. Separation of placenta from the lower uterine segment. The correct answer is C. Implantation of placenta in the lower segment of the uterus. So A is the definition of abruptio placenta and B is the definition of ectopic pregnancy. So the correct answer is C. Question number 2. Which of the following theories explain the reduction of incidence of placenta previa in the late third trimester? A. Stationary growth of the lower placental edge toward the cervix and growth of lower uterine segment. B. Faster growth of free uterine wall than placental covered area. C. Trophotropism. D. All are correct. The correct answer is D. All are correct. These are just called placental migration theories. Question number 3. The overall incidence of placenta previa is A. 1 in 500 deliveries. B. 1 in 1,000 deliveries. C. 1 in 100 deliveries. D. 1 in 200 deliveries. So the correct answer is D. 1 in 200 deliveries. So the overall incidence of placenta previa is 1 in 200 deliveries. Question number 4. A type of placenta that touches the birth canal but does not cover it is called A. Partial. B. Marginal. C. Low-lying. D. Complete. The correct answer is marginal. So in partial one, the placenta covers partially. The placenta covers the birth canal partially. In marginal, the placenta, the lower edge of the placenta touches the birth canal but does not cover it. And in low-lying, it's about 2 centimeters from the birth canal or the cervical canal. And incomplete, just the placenta totally covers the birth canal. For this question, marginal is the correct answer. Question number 5. One is not risk factor for placenta previa. A. Previous cesarean section. B. Use of hormonal contraceptives. C. Previous history of placenta previa. D. Cigarette smoking. The correct answer is B. Use of hormonal contraceptives has not been found linked to placenta previa, so this is not risk factor. Question number 6. Which of the following factors puts the mother at highest risk of developing placenta previa? A. Advanced maternal age. B. 2 previous cesarean sections. C. Assisted reproductive technology. D. Previous history of placenta previa. The correct answer is D. Previous history of placenta previa. It increases around 9-fold. Two previous cesarean section increase about 2%, but the greatest factor is previous history of placenta previa, which increases around 9-fold. Question number 7. Which of the following pair of factors are confounding to be risk factor for placenta previa? A. Age and puberty. B. Previous cesarean section and smoking. C. Multiple gestation and age. D. Previous cesarean section and assisted reproductive therapy. The correct answer is A. So age and puberty are confounding. We don't know the exact factor of age and puberty separately. So these are confounding factor. Question number 8. Which one is the most characteristic event of placenta previa? A. Painful and tender uterus. B. Painless and causeless vaginal bleeding, C. Dark red vaginal bleeding, D. Bleeding collected in the Kuldo sac. The correct answer is B. Painless and causeless bleeding. The other are A and C are the feature of abruptio placenta. So the correct answer is B. Question number 9. All are the clinical features of placenta previa except one. A. Painless vaginal bleeding, B. Causeless vaginal bleeding, C. Recurrent vaginal bleeding, D. Dark red vaginal bleeding. The correct answer is D. Dark red vaginal bleeding. This is the feature of abruptio placenta, and the other are the feature of placenta previa, which is painless, causeless, recurrent vaginal bleeding. So that's the typical signs of placenta previa. Question number 10. On abdominal exam, which finding is suggestive of placenta previa? A. The uterus is usually greater than period of gestation. B. Always associated with malpresentation. C. Relaxed and non-tender uterus. D. Tense and contracted uterus. The answer is C. Relaxed and non-tender uterus. So the uterus is not greater than period of gestation, usually equivalent with period of gestation, and there is malpresentation, but it is not always. Usually there is malpresentation, but not always. Tense and contracted uterus, this is not the feature of placenta previa, it's the feature of abruptio placenta. So the correct answer is relaxed and non-tender uterus, C. Question number 11. The best diagnostic modality for placenta previa is A. MRI, B. Sonography, C. Double setup examination, D. CT scan. The correct answer is B. Sonography. So the sonography is the best diagnostic modality for the diagnosis of placenta previa. Question number 12. Sarah, a 35-year-old woman at 25 weeks of gestation, is being scanned by ultrasound. Then the placenta is found to be in the lower uterine segment, just covering the birth canal by half. Other than this, the fetus is normal, no vaginal bleeding, and she is in good condition. What is the best next management? A. Admit her in obstetrical unit. B. Counsel and repeat ultrasound scan later. C. Terminate the pregnancy. D. Give steroids and schedule for cesarean delivery. The correct answer is B. Counsel and repeat ultrasound scan later. So if there is no bleeding and if the condition of the fetus and the mother is good, so since due to the migration of placenta toward the upper segment of the uterus, we will wait by counseling danger signs, and we will scan later to confirm whether it is in the lower or in upper segment. So B is the correct answer. Question number 13. The preferred route of delivery for patients with placenta previa is A. Vaginal, B. Cesarean section. The correct answer is cesarean section. So practically all patients with placenta previa should undergo cesarean delivery. So the preferred route is cesarean delivery. Question number 14. What percentage of placenta previa can be diagnosed by transvaginal sonography? A. 85%, B. 90%, C. 95%, D. 100%. The correct answer is D. It can diagnose 100%. So transvaginal ultrasound can diagnose 100%. Transabdominal, it can diagnose around 95%. Question number 15. Why does bleeding from placenta previa is severe? A. Due to less contractility of lower uterine segment. B. Due to depth of placental invasion. C. Due to higher blood supply. D. A and W correct. The answer is D. So due to less contractility and the depth of placental invasion in the lower uterine segment, bleeding is severe in placenta previa. That's the correct answer. Question number 16. What percentage of placenta previa cases resolve in their own before delivery? A. 25%, B. 50%, C. 75%, D. 90%. The correct answer is 90%. So due to something called placental migration, most of placenta previa in the second trimester will resolve on its own before delivery. Question number 17. In which placenta previa can vaginal delivery be considered? A. Placenta previa partialis, B. Placenta previa with 2 to 3 cm away from cervical canal, C. Placenta previa low-lying with posterior, D. Marginal placenta previa. The correct answer is B. Placenta previa with 2 to 3 cm away from cervical canal, and if the placenta is anterior, maybe vaginal delivery can be considered. So that's the correct answer. Question number 18. Which condition needs immediate delivery in placenta previa? A. Dead fetus, B. Patient is in labor, C. Bleeding is continuing, D. All are correct. The correct answer is D. All are correct. So in these three conditions, immediate delivery is necessary. So all are the codes for immediate delivery. Question number 19. Which factors are to be considered in the management of placenta previa? A. Fetal maturity, B. Associated labor, C. Bleeding severity, D. All are correct. The correct answer is D. These three conditions should be considered in the management of placenta previa. So don't forget these three conditions. Question number 20. Complication of placenta previa includes A. Hemorrhage, B. preterm labor, C. Postpartum hemorrhage, D. Placenta accreta, E. All are correct. As you may guess, the answer is A. So these all are the complications of placenta previa. So that's it. If you have any questions, it's possible to ask on the comment section down below, and write down how many questions you answered correctly. And thank you very much. That's it. Thanks for watching, and subscribe to my YouTube channel to get my latest videos.